Hi everyone, I'm Dr. Anya Weissman. Welcome to my channel. Today we are discussing the Radical Night Repair in detail. We're going to talk about the formulation, how to use this as a peel, and what it's indicated for and what benefits you can experience or expect from this product. Please like, subscribe, share with a friend, and hit the notification bell. And let's talk about this product. This product is designed to really speed up desquamation of the skin. In other words, exfoliation of the superficial cells of the skin. When the skin is exfoliating at a faster pace on the surface, what the cells communicate to the deeper layers in the dermis, or actually the dermal epidermal junction, is to say, we need more cells turning over. We are sloughing off at a fast rate, so you need to speed up mitosis or speed up cell division. You need to speed up cell maturation and push these cells up to the surface because we're running out of surface cells and there won't be any left soon. So speed up the production. And that's how we increase cellular turnover or skin turnover. In kids, cellular turnover is 4 to 6 weeks. And as we age, it can be as long as 10 weeks. And that's when deep wrinkles can set in. And that's when texture is really created, because you have layers and layers and layers and layers of dead, dry skin. Those stratum corneum, the superficial layer, keratinocytes, are just dried up and empty. When you increase the cell turnover, the superficial layers of the skin and the stratum corneum actually begins to look different under the microscope. The cells are more gelatinous, just like in children. If you look at children, they don't have dry, textured skin. Their skin is always plump and juicy and perfect. Even that stratum corneum, it's not dry and flaky. It's gelatinous, it's rich, it's bouncy. So that's what we aim to achieve when we speed up the skin cell turnover. This formulation is anhydrous, or without water. This formulation involves oleosomes, which are lipid molecules that can be dissolved by the fat that's in the epidermis, because fat likes fat, so they just kind of dissolve away. They sit on the surface and they're high molecular weight, and as they slowly begin to enter the skin, the oleosome, the fat capsule, is dissolved by the epidermis and the retinol is released. So the primary target is the superficial epidermis. What you can expect from treating the superficial epidermis is that you will improve fine lines, pigmentation, and texture. If this product is used long-term, then the skin will experience bioaccumulation, meaning that retinol will continue to accumulate in the skin. And as it accumulates and the concentration of that retinol is slowly creeping up, then you will begin to see more dermal benefits, those benefits that are more to do with anti-aging, like collagen synthesis, like hyaluronic acid synthesis, collagen synthesis? Glycosaminoglycan synthesis, more on that deeper dermal level, because you're getting more and more of that retinol in the skin, so it's penetrating deeper and affecting the deeper layers. So how do you use this product as a peel? Well, there are multiple ways of using this product as a peel depending on the strength. You could do a mild peel, moderate peel, and a strong peel. You can do a 3-day peel, a 5-day peel. It's all up to you. What can you expect from this peel? Some improvement in fine lines, pores, and texture. Also a strengthening of the skin barrier and improvement in pigmentation. This peel is contraindicated in women who are pregnant or lactating, 18-year-olds or younger, unless supervised by a physician. Anyone who has any wounds or breakage of the skin surface on the skin, sunburns, wind burns, any irritation or sensitivity on the skin, also any cold sores on the mouth, those would all be contraindications. If you're planning on doing this peel, it is really, really important to precondition the skin before the peel. What that means is that you start using a retinol that's at least 0.5% for 4 to 6 weeks before you attempt this peel. You have to get your skin to a place where it tolerates a 0.5% retinol every single night. If your skin doesn't tolerate a retinol 0.5% every single night, this peel is too strong for you and you should not do it. And I have a whole video talking about preconditioning the skin before peels and laser treatments, which I will link down below. And the reason why it's so important is because when we retinize the skin, we strengthen the skin. When the skin is stronger, it is more resilient to insult, whether it is microneedling, so a physical insult, or a thermal injury from a laser. Our skin recovers better, it gets less damaged because it's stronger and more resilient. So it's very, very important to have strong, healthy skin and prep the skin before peels and laser treatments. If you're attempting this peel for the very first time, it is recommended that you start with a 3-day mild peel, just to kind of dip your feet in the water before going all out. So start with that. If you continue to do the peel, the ideal recommendation is that you repeat the peel every month for 3 months. And then for yearly annual maintenance, you would do this peel 2 to 3 times a year. What you can expect your skin to go through during the treatment are the typical retinol anticipated reactions. So day 1, day 2, you might see nothing at all. You might feel a little tightness. Day 3, you will begin to see some peeling. Day 4 and 5, you will see intense peeling. Your skin will also begin to get red on day 3 and will continue to get more and more red on day 4 and day 5. You might be itchy, but you will definitely be exfoliating more and more as the days go on. Okay, let's talk about doing the peel. The first thing you're gonna need is you're gonna need a very effective yet gentle cleanser. You may opt for the Zeo Gentle Cleanser. You may opt for the Balancing Cleansing Emulsion or the Hydrating Cleanser. You could use the Alastin Gentle Cleanser, or you could use the Skinbetter Cleansing Gel, whatever your favorite gentle and effective cleanser is. After that, you're going to apply 2 to 3 pumps of the Daily Power Defense. And once that's all absorbed, we use the Radical Night Repair. For the mild peel, you'll use 5 pumps. For the moderate peel, you'll use 8 pumps. And for the strong peel, you'll use 10 pumps of this product. Once that's all absorbed into your skin, you're going to apply your favorite sunscreen. It's really important to use sunscreens because we're going to be sloughing off a lot of skin. We're going to have less stratum corneum to protect us. Sunscreen's really important. So whether it's your Colorescience Flex, or it's your Zeo sunscreen, or it's your Skinbetter sunscreen, choose your favorite and use it liberally. In the evening, much in the same fashion, we're going to cleanse our skin. After that, we're going to apply 2 to 3 pumps of the Daily Power Defense. Once that's absorbed, we're going to apply 5 pumps for the mild, 8 pumps for the moderate, or 10 pumps for the strong peel, and that's it. You will repeat this routine for 3 days if you're doing the 3-day peel, and you will repeat this for 5 days if you're doing the 5-day peel. On the following 2 days, so for the 3-day peel, day 4 and 5, and for the 5-day peel, day 6 and 7, you will wash your face with your favorite cleanser, apply your Daily Power Defense, and after that, you will apply the Hydrating Creme from Zeo. And you will use this liberally, and you will apply it up to 5 times a day. This is now time to heal the skin from that significant exfoliation that we did. So this will soothe, protect, calm, help the redness reduce, and help your skin heal. So this is applied up to 5 times a day on the 2 days after the peel. So for the 3-day peel, day 4, day 5, 5-day peel, day 6, day 7. And of course, you follow up with your sunscreen in the morning, and in the evening, you just apply this and you're done for the night. On the following day, after those 2 days of hydrating cream, you go back to your routine skincare routine. What is happening on a cellular level? On day 1 and day 2, the retinol is reaching the superficial epidermis. On day 3, it goes a little bit deeper. On day 4 and day 5, it begins to reach the deeper levels of the epidermis. And this is the bioaccumulation I mentioned before. While the concentration of the retinol in the skin is increasing, it's diffusing further out and going deeper. So that's why the 5-day peel will have a little bit more deeper effect than the 3-day peel. If you've tried the 3-day peel and you did fine, I would recommend stepping up slowly to the stronger peel. So first do the mild peel, then try the moderate peel, and save the strong for last. And that's how you do the Radical Night Repair Peel. So those are the different strengths and lengths of the chemical peel that you can do at home with the Radical Night Repair. That is what the product was designed for. Other fantastic uses, the way I love to use Radical Night Repair is on individuals that have severe sun damage. Just a lot of California sun over the years where the skin starts to look leathery and it doesn't have a good look to it. Radical Night Repair is fantastic at removing that in high doses. Patients aren't happy, they're itchy, they're red, they need that hydrating cream, but you can get beautiful results in removing that pigmentation. It can be applied to the arms, the décolleté. You have to be a lot more careful here because the skin is very, very sensitive here, so a different, much lighter protocol. It can be performed on the legs, on the knees, anywhere practically to help remove that pigment. And when you're doing high doses, then you actually do start to see resurfacing of that skin and reduction of fine lines and wrinkles. If you're going to do high doses on your body, I would recommend doing them under the supervision of a professional. If you would like, I do virtual consultations so we can do it together and I can guide you through the process. Or if you have a ZO provider near you, I would encourage you to do that, then go on your own. Just in case you hit an unexpected result, you're not sure if you're experiencing allergies versus anticipated reaction versus unintended reactions, it's always best to be under the care of a provider. This video is meant to be educational only, so I am not telling you to do any of those things. Everyone has a different skin sensitivity. Everyone has a different skin tolerance. It does not mean you should dive into the Radical Night Repair peel. This is just for informational purposes. If you are doing the peel, if you want to know what the protocol looks like, how to follow it, it's pure education, non-sponsored, of course. And if you have any questions, please leave them down below, and always check with your clinician before starting endeavors like this. So I hope this video was helpful, and I'll see you guys in the next video.